I am Dr. Ravi Mathur, and I have been working since last 50 years in the field of medical. Today I will talk about diabetes in a very simple way so that you can understand it well. Diabetes is a chronic disease, a long-lasting disease, more or less a lifestyle disease. We don't have a permanent cure for the disease. But if we take proper treatment and take proper care, we can control this disease. If we don't take proper treatment and are careless, then serious complications may arise. 10 to 20% of the world population is suffering from diabetes, and mainly most cases are in India and China. In India, there are so many cases of diabetes that it is known as the diabetic capital of world. Now, what is diabetes and why does it occur? When we eat food, the digestive system of the body converts this food into the glucose and release it in the bloodstream. Simultaneously, the pancreas also releases the insulin in the bloodstream. Now, what does insulin do? Insulin it directs and enters the glucose into the body cells where the body cells convert this glucose into the energy. And this energy is utilized by the body to perform activities and its functions. Now, in some cases, there is no formation of insulin or the body cells somehow become resistant to the insulin. The glucose don't enter the body cells, hence remain in the bloodstream, and the blood sugar level goes high, and hence diabetes. Now, what is normal blood sugar level? We measure the blood sugar level in the following way. The first is the fasting blood sugar level, that is in empty stomach or 8 to 10 hours after the meals. If we measure the blood sugar level, that it should be roughly around 70 mg DL to 110 mg DL. This is fasting blood sugar level. The next is 2 hours after meals or postprandial blood sugar level. If we measure the blood sugar level 2 hours after the meals, it should not be more than 140 mg DL or 150 mg DL. And the third way to measure is the HbA1c. It should be 5.6 to 5.7%. That is the normal level of blood sugar level. Now the types of diabetes. In type 1 diabetes, the autoimmune system of our body destroys the insulin forming cells of the pancreas. That is our own autoimmune system destroys our own pancreatic cells, so no insulin is formed in the body. Hence, the glucose level in the blood goes high. In type 2 diabetes, somehow the body cells become resistant to the insulin. So no glucose enters the cells and remains in the blood, and the blood sugar level rises. That is type 2 diabetes. And the third is gestational type of diabetes, that is found mainly in the women's. When they get pregnant, due to the hormonal changes during pregnancy, the insulin formation is less, hence the blood sugar level goes high. But after the pregnancy, this blood sugar level becomes normal. That's all about the basic of diabetes. If you have liked my talk, please like it and subscribe it. Thanks.